everybody. Welcome to another episode of Clinic Gym Radio. I'm always your host, Dr. Josh Satterlee, and I'm honored today to be joined by Kevin Carr out in Boston, Mass. Kevin, how are you, buddy?
I'm awesome. Thank you for having me on here.
Awesome. This is exciting for me because, Kevin, we go way back to the streets of Providence, the mean streets of Providence, Rhode Island. Shit, that was like 7 years ago or something when I first met you. But since then, you have seen some amazing changes in the world of fitness, in the world of integrating fitness and medical, and I've always appreciated the fact that you are an educator among many other things, and I'm hoping you can educate some of our people today.
No, hey, Providence is where it all happens, man. I'll tell you, it's time flies though. 7 years, and I think you're right on that timestamp. So it's crazy how quickly stuff changes. But hopefully, I can be of some entertainment to the people listening, and I'm happy to be here.
Absolutely. All right. So can you give everybody a little breakdown of where you operate out of and what you do so they can kind of get you on the map in their mind?
Yeah. Primarily, I'm a coach at Mike Boyle Strength and Conditioning in Boston, Massachusetts. And I've worked there as a strength and conditioning coach and personal trainer for 10 years now. So when people tend to ask me what I do, the first answer I always say is I'm a strength and conditioning coach. In that job, it kind of progressed into me also becoming a massage therapist. So Brendan Rierick, who I went to school with, I went to UMass with Brendan, was working.
You guys met over foam rolling, right?
We did. We bonded. Yeah. If you've ever been in a college, like rec center, it's lots of guys flexing, lots of testosterone, people not really talking. And Brendan and I kind of did the whole, circle around each other for a little while without saying anything. And then he saw me on a foam roller, and that's how we broke the ice, was how we learned to foam roll. So yeah, and it's all history from there.
Yeah, that was as functional as that place got right then, right?
Yeah, no one had ever brought a foam roller into that gym. There's lots of bench press. We eventually, when we met it and we worked together at Mike Boyle Strength Conditioning, we eventually decided, we both went back to massage school and started Movement is Medicine, which Mike was gracious enough to let us do within his facility. And we started a rehab clinic for the clients at MBSC right there. And now that has progressed further into us building an education business with certified functional strength coach. So my home is definitely all underneath that MBSC roof. But I have, lots of hats to wear in that one place. So it's a nice place for me to be.
For a second, go back to when you guys started the Movement is Medicine. Before that, you were young, motivated, certainly with the best mentor you could ever wish for in the world, strength and conditioning, right? With Mike Boyle. What was the pressure that kind of, not forced, but motivated you to go and pursue the massage therapy license? Because that wasn't easy, right? That was nights and weekends and long days, right?
It's funny, I know both Brendan and myself, when we were going into school with a kinesiology degree, we toyed with the idea of, doing physical therapy or doing athletic training and doing strength and conditioning. So we had a passion for exercise and fitness. And then we both got experience within the fitness world, really wanted to kind of keep the majority of our work in strength and conditioning. But at the same time, when we were working with some people, we thought like, hey, I could help this person more kind of closer to the rehab end of the continuum. And then in talking with a lot of people, both physical therapists, both strength and conditioning coaches and massage therapists, we found with the population and the work that we wanted to do, we thought, well, massage therapy is something from a practical standpoint that I can continue working at MBSC and do. I can afford it, as we were like paying out of pocket kind of like month by month, and work with the population I want and kind of build that vision. So we consulted with people about like, okay, is this really a doable thing? And then it was helpful to have a friend that Brendan was living with me at the time. We were roommates, and we'd say, okay, let's just commit, a couple nights a week. And then on a Saturday, we're going to get this done in like a year to 18 months. And we just kind of put our head down and built it and then built a business right from there.
That's awesome. Couple questions. I love the fact that you did it that way because, I teach for SFMA nationwide and talk to a lot of physical therapists and chiropractors and athletic trainers. And when you ask, especially the PTs, and for PTs listening, I'm going to play the stereotype game here because it works. Sorry. But when you ask PTs, why'd you go to PT school? They like 8 or 9 out of 10 of the answers will be, I wanted to work in sports. And then second question, what do you do now? I work in outpatient orthopedic rehab. Mostly doing what? Geriatrics and joint replacement. Right on. And it's sad because, everybody went into PT for sports, and you see that in chiropractic as well, but they're not working in sports, and you were able to stay within that thing that you want to do and work with athletes, certainly, right? And have this additional skill set. I think you might be there's a little sweet spot in that Venn diagram of where can you have a lot of hands-on skills, a lot of fitness continuum, and there's another little asterisk without spending a ton of cash. And it's like, well, there's only one way to do that.
Yeah. And we backed into it. And I remember, I think seeing the strength and conditioning end of things and being like, okay, I can provide, if I have the right manual skills and I understand exercise, how it fits into rehab the right way, like I can have a really big effect in my environment and get the job done how I want without losing, what I really want to do for a living and how I identify myself as a coach. And that it worked out really well doing it that way. And not everyone has the luxury of kind of like, I would tell people, like, I started thankfully on second base. Like my first real job in fitness outside of Gold's Gym was Mike Boyle Strength and Conditioning. So I was lucky to be able to kind of see that as my first window instead of having to find myself thereafter. But in doing that, it helped put me in connect with the people who would teach me how to work the massage stuff and how to work the rehab stuff into what we were doing, because it helped me build that network early. And
for people who aren't familiar with movement as medicine, when you say massage, you're not, there's not Enya playing and like low level lights and right. I mean, like this is a different, the skill set, but that's not the clinic setting, right?
Yeah. We had to go through some of that in massage school, but then the goal we always tell people is I want to spend as little time on the treatment table as possible. And then we want to get you moving and starting to move towards things like look like exercise as soon as possible. And we've kind of built that reputation that like people don't come here for spa time. So the identity we've built is kind of made that for itself. But yeah, it is therapeutic in mind and with an exercise outcome as the goal. Yeah.
So you still haven't yet bought your first set of magical crystals?
I do not have any of those, and I do not have. The
massage board hears about this, they're going to pull your license, brother. Like, you better check on that.
I haven't got any of those massage music DVDs playing either.
Yeah.
So yeah.
Awesome. Well, let me ask you this, because I'm interested, because I know that if there's one thing Mike Boyle Strength and Conditioning is known for, it's like, do not injure your client. Like, and you guys work hard to basically reduce as many exercises out of your program that have the possibility of being, whether it's ones that make, shoulders cranky or low back. Like you guys don't advocate back squatting because of the stress on the low back and whatnot, right? Mm-hmm. So here you have the best coaches in the world running the best program in the world that has been specifically designed to not injure patients. Yet you're telling me that there is still a need for you guys to go to massage school, right? Yeah. Tell me about that, because it's kind of surprising, but I want to know how that works.
Yeah, no, absolutely. I mean, obviously the number one thing we always say, like you mentioned, was reduce training related injuries. I don't want people buckling on a squat. I don't want people, doing things in the weight room that could potentially lead to mistakes. Right. That said, we still have, whether it's general population people, because we're about 50-50, regular people and athletes who come in with, hey, my hip really started aching me when I left work today and I was sitting in the car, or the athlete saying, hey, I played a bunch of games this weekend, my hip feels jacked up. So you have those kind of wear and tear chronic things that you're going to deal with, whether it's them dealing with an old injury or them have something else that's popping up. And that's really kind of what drew us into it. Is like, I'm sick of, Jim coming in and telling me how his hip is achy and he's not willing to go see a therapist outside here for treatment. But I think based on me looking at his hip, that if I give him some manual work and then start to provide him some exercise, that I can solve this problem for him. Because we used to fight the battle of like, okay, go see this PT or get this referral or whatever. And then things might not change for that person. I said, well, I'm going to just find a way to try to provide that service for them if that's possible. And that's really what helped Brennan and I kind of see that opportunity there. Not just as therapists, but yes, obviously as business people, there was a window for us to be able to provide a service there that wasn't being serviced.
So no matter what gym it is, the best in the world, you're still going to have people that, probably what the deal is, it's not your program. It's the fact that your program is working with people who still sit 80 to 90% of their day. Right. And then it's like, hey, now I'm going to teach an exercise that puts you into full hip extension in the active range of motion. And it's like, well, shit, I haven't done that in 20 years. And it's like, I know, but we're going to walk you through it, you know?
Yeah.
And, it's what they're not doing when they're with you guys. It's probably throwing them off.
Yeah. Training is stress for everyone. Like you said, there's a lot of people come in and they're not set up to deal with that. And you have to kind of walk them to it and sometimes provide them a little extra something outside the training session to help them adapt the way that you want. So yeah, I think that no matter where you are, you're going to have people who don't feel right. And I think sometimes when you look at the internet, everyone thinks like some training centers are like some panacea that's like perfect. Like everyone feels great. But no, I mean, you walk in, you could see any population of people dealing with all sorts of ailments in MBSC, just like you could, anywhere.
Yeah. I mean, you even seen it like a Lifetime Fitness, for example, major, massive chain, and they're putting clinics in every one of their places because they're, like you said, a business opportunity is just there. It's just, hey, people need you. They might not need you. The population that's inside this building working out 3 days a week or more may not need you as often as a different population would, but certainly that doesn't eliminate them from doing it,
Exactly.
like from needing the work. Yeah. So this is great because I think that there's a lot of people out there who are thinking, we're talking to chiropractors and physical therapists, and they're thinking like that they need to wrap their arms around every quote unquote patient in their clinic. And one of the things we try and do with our program is encourage them, like, there's probably 30% of your clientele that could be handled by a really great trainer, or certainly there's definitely 30% that could be handled by somebody like yourself that is a strength coach and a massage therapist, like having those two skill sets. What like, how do you navigate that? Like, when do you end up sending people to a physical therapist or chiro?
So I use the SFMA, which obviously,
yeah.
You're an instructor in, and I use the boxes to guide my way through that client. Okay. Right. And if I run into something that needs like a joint thrust or a mold that I'm not qualified to do, we have a PT in the building in John Paloff. I can send over there. We have a couple other PTs in the area I send to.
By the way, if anybody's ever done Paloff presses for their core, that's the dude who invented Paloff presses.
Hence right. I see him every day.
Yeah.
So I'll send to him or another PT, or, if it's something that's really acute, like I'm not an athletic trainer or a PT to deal with something like you just did. I'll say, hey, why don't you go see them for the acute care? If you need me, come back. So, I deal with tissue extensibility issues. I deal with motor control issues. The vestibular stuff I'll refer out. So it's like the big thing that really has helped our business, I'd say more than anything else, is having an assessment process that I believe in and trust, because it keeps me targeted on the things that I can treat and I can manage, and it helps me easily refer out and say, okay, hey, you're going to go across the hall, or you're going to go down the street and see this other person. And I think that's what I always tell massage therapists or trainers who look into massage school and think, hey, I want to do this. I say, well, you have to believe in a system that's going to keep you and the prospective patient who's coming to see you safe and healthy and get them the best treatment. Because you can't treat everything. Because even the best PTs have to refer to somebody else, or should often refer to somebody else sometimes, and they don't. So that has really been the baseline, is having the right lens to look at everything through.
Nice. Yeah. And you also were saying before we started recording that in the CFSC programming, which I think is like the best strength and conditioning program that anybody can learn. And I would say it even bleeds into rehab a lot. Like if you look at a Venn diagram, one of the things you guys have done is kind of like taken a strength coach and taught them enough of the lower level exercises that in an office would be called rehab, but really might just be where that person needs to start fitness. And it also allows the clinician to go, all right, what's after this easy rehab? How can I get them back to playing a sport, jumping, running, hiking, all those things they want to do? Because most rehab ends way too early, in my opinion. Like there's no load involved. There's no stress to the point where you're actually stressing the joint. So I really like the fact that you guys are doing that program. But what are you seeing in your courses there as far as like the division of strength coach, collegiate strength coach, maybe concerned parent, clinician, all those different people? I know that all those have entered your rooms, right?
Yeah, it's been way more diverse than we originally thought. I remember when we first started to kind of plan it out, we talked about thinking, okay, it's going to be mostly the personal trainer and like the private strength and conditioning coach. We didn't think we'd have as much of a touch with the collegiate and professional levels. And there's been more of those, but then the more unexpected was the chiropractic, the physical therapist, people from the medical realm in general, some doctors that have come in to try to think, okay, what do I do towards the end of it? And what is the exercise component? Because they haven't coached exercise. And I really commend the medical people that have come in and said, okay, I've never taught deadlifting. I've never taught push-up really. I've never taught like plank properly, and taking them through that and exposing them to that has been really, really cool. So that has been a really growing demographic, and it's really encouraging to see.
Hey, we'll get right back to our interview with Kevin Carr after this quick message. Hey, I'm really excited that Clinic Gym Radio now has a sponsor, and that sponsor is the CSA Academy. That's the Chiropractic Success Academy. And you can check them out at membership.csacircle.com. Now, what is the CSA Circle, the Chiropractic Success Academy Circle? Well, it was a program developed by Dr. Bobby Mabey and Dr. Kevin Christie, two of my friends and two people who I believe are leaders in the industry. And what they saw was a need for chiropractors to get the basic skills to have a successful clinic operating day in and day out. And they kind of divided it into four things. Number one, you have to be a great clinician. And so they share information and knowledge and techniques and whatnot to help you become or maintain your skills as a great clinician, because that's what your patients are showing up for. But secondly, if you're doing it on your own, you got to have great business skills. So there's the business person track as well that teaches you things about finance and running reports and what numbers to look at, and maybe even help you with bookkeeping. And then they say there's also the human being, right? There's that person that needs to have that success mindset and that idea of, hey, I'm going to make this, and keeping yourself sane. I know there were dark times in my career, and I bet there's dark times ahead. And having that positive mindset is certainly a huge help. So they share information with that. And then finally, they talk about the producer. Anymore, if you're going to be advertising and marketing, you have to be a producer of quality content, whether that's blogs or videos or ads or writings or articles for a local newspaper. It does not matter. You have to be constantly producing quality content. So they have coursework around that, how to maintain your sanity while putting out fantastic content and in a volume that will help actually build your practice. So if any of those things are of interest to you, then definitely check out the Chiropractic Success Academy, and that's at membership.csacircle.com. Again, that's membership.csacircle.com. Dr. Bobby Mabey, Dr. Kevin Christie, they're good guys. I believe in them. I believe in their product, and I believe in you too. And I hope you're getting value out of this podcast. And if you wouldn't mind going and giving them a look to see if it's the right fit for you, I would certainly appreciate it. They're paying for the production of this episode, so at least we can do is tip our cap, take a gander, and hope that maybe those people who would find value in their product end up signing up. So let's get back to our interview with with Kevin Carr. Not yet a doctor, but let's get back to our interview with Kevin Carr now. What are typically the questions you get from the maybe private strength coach or personal trainer that's in the gym versus what are the questions you get from the clinicians that chiro, PT, athletic trainers, all that in that kind of realm?
Mm-hmm. From the personal trainer and the privatized like strength and conditioning coach, those types of questions lots of times are performance related or dealing with
or how to pose on Instagram.
Yeah, well, that too. There's a lot of how do you get the right light on your pictures. But things like performance related, like, hey, should I stretch before I run? Should I squat below parallel because I had a doctor tell my client no? Things like that. Like those types of the ones that like you could think the average personal trainer who might not have as much experience might ask.
Okay.
From the medical side of things, it's more or less basic exercise coaching, because that's kind of where their blind spot is. Mm-hmm. Like they might understand, the recommendations, the things that the personal trainers might ask, but they don't have the basic understanding of, okay, this is how we progress a load. This is, how I make things easier or harder, or my major coaching cues to get the things in the positions that I want, because they don't have the one-to-one exercise coaching skills that maybe a personal trainer or strength and conditioning coach might have. So that's really fun, because it's like dealing with someone who's getting excited about exercise for the first time. So like when you see someone who's like spent all their time, said like with the typical like outpatient clinic and not, had to teach someone how to deadlift, and they start to connect the dots between, okay, this is why it might help their back pain, or teaching them to heart style plank, why that might, help them with their chronic back pain. That's really a cool experience.
Yeah. It's crazy what introduction to strength will do to some chronic pain cases, like people that have, had, especially low back. I find, like, if you just get their legs fired up, like 2 workouts in, I'm not talking, there's no way it could be hypertrophy. Like, it's way earlier than that, but just that neurological sequencing, or I don't know if it's like a giant reset for the body, but God dang, does it change lives sometimes. And you're like, I've had patients tell me, like, nobody's ever taught me this stuff. Like, I don't understand why. I've gone through 4 other places. Why did nobody show me this? You're like, man, we just basically got, you do some glute bridges and then I'll teach you how to deadlift, and it just changes their whole body. It's incredible.
Yeah. And like you said about, like, it could be like a session or 2 and they're like, hey, I feel better. And then you said, and like, that that's not them gaining muscle. You just know that they couldn't have not have added muscle mass in that time.
Right.
And I was talking.
Well, I am a pretty good coach.
Yeah.
So I could probably no.
I was talking to someone about this the other day, about like half the job about being a really good person who prescribes exercise, especially in the rehab end of things, is if you give them the right cues and you give them the right progressions, half of it is not necessarily physical tissue change as much as it is psychological guarding. Hey, it's okay for my knee to get in this position because I'm holding this TRX. You might not have changed the tissue there, but after 2 sessions, like, oh, my knee feels stronger and feels better, because psychologically they feel better. And then that progression 3 weeks later, they feel comfortable going to. And then at some point it becomes the actual physical change of hypertrophy or the elasticity of tissue, whatever it might be. But half of like the progressions and regressions and things in CFSC are, hey, it's safe for me to do this exercise now from a rehab perspective.
Yeah, it's crazy. That occurs. I don't know if you saw the study, but Mike Voigt over at Belmont was telling me there's actually a study they did with cross-sectional MRI of the multifidi. So that's a huge sentence right there. But and after 2 weeks of rolling protocols, you're familiar with the rolling, right? Like in the SFMA, that they doubled in size. 2 weeks. Now, not what which is crazy, because oftentimes the number one driver of low back pain is this idea of atrophied or non-used multifidi. And here he's saying, yeah, just rolling puffs them up or fills them up. Like, it's got to be blood flow or something like that, because it's too fast. But they see it on cross-sectional MRI. So that's one of those, it just blows my mind. I don't know the mechanism, but who cares? Like, if it works, it works.
Exactly. I don't need to know how.
Yeah. And if an RFE gets that person to, like, all of a sudden there's more of their strength is coming from their legs, or they're using their legs more than their back in daily activities, perfect. If that woke them up enough, I don't care about the mechanism, it's great. So what along the lines, what's the most surprising question you've ever had at a CFSC from like the medical community? Like, did one blow you away?
Well, maybe just sometimes, like, I just assume people know more about exercise than they do. I think kind of when I've been doing it for a little while, I just assume some of the stuff that, you might have learned years ago that they might have got maybe in their education somewhere, but then you realize they have a completely different history than me. So, just basic, again, like, should they squat below parallel? Is breathing important?
Which is like a question that you figured went out with like Richard Nixon's presidency, right?
Yeah. Things like that. But then again, you realize when we started the CERT, we kept saying, we're making this too easy. Parts of this are too easy. And I always liken the fitness industry to an iceberg. Like, the people you see, the people you relate yourself with on social media or in your education circles are what's above the waterline. The majority of everything else is below that, right? And that's what'll sink the ship, right? And so you got to realize those are the people you have to educate. You have to go provide answers to them, and then provide in a way that you don't feel like, sometimes people talk down to the people don't know, realize that these people don't know what they don't know. So now I don't really get as surprised as I used to, because at first I was kind of like, oh, you don't know this, but then you teach enough and you realize a lot of people just don't know a lot of things.
Yeah, that's funny. What's something that you've totally changed your mind on in the last like 2 years? Like something that you were totally for and now you rail against it, or opposite? Maybe an exercise that you thought was great and now you're like, it might not have been a good job.
Let's see. Something I was against.
I asked Jason, Jason Glass up in Vancouver.
Yeah.
I asked him and he goes, "Oh, battle ropes too early in a program." He's like, "Yeah, that one took me about 6 months to figure out because it takes about 6 months for the elbow tendonitis to really develop." And I thought, why does everybody in my gym have elbow tendonitis? It's like,
a few things. One, this is something Mike's talked about. We're doing sprint timing like almost every single day with athletes now. With our athlete program, pretty much daily.
You have started doing timing every day that they're in the gym.
Yeah.
Okay.
We just need to sprint more. We were worried more about, things like hip flexors and hamstring strains, but we've progressed kind of how we do the timing, and that we found timing the sprints daily makes a huge difference as far as how hard they run and giving them feedback. And we talked about in the staff meeting yesterday, and we always talk about, sprint mechanics, coaching all the little things about sprint mechanics. But sometimes you just have to have them sprint, right? And when you liken it to teaching someone to ride a bike, you could tell someone, hey, when you get on the bike, the seat has to be straight. And, then you have to start pedaling slow. And then when you turn left, you turn the handlebar. But they don't really have an idea of what riding a bike is until they ride the bike.
My friend always says, I can't teach you how to swim standing dry on the deck.
Yeah. And so we've done more volume of time sprinting, and we've seen our athletes all get a lot faster.
Wow. How are you objectifying it, by the way? Or like stopwatch or using lasers? What do you use?
We have a laser. So we have a Brower timer. So, and then we just record all the kids every single time, and we just mark PRs and things like that.
Nice.
And then also something I've worked in a lot of people is just more sled work. And I've always liked sled, but even into like the main lift for both our athletes and our adult clients, something that we used to kind of use more as like a conditioning tool or just like a speed specific tool. As it relates to the athletes, I think it's a great way to get a lot of load into hip extension. That's pretty sprint specific. But then for the adults, even more so, it's very low risk, high reward. There's nowhere where you're going to load an adult that heavy without some sort of risk of like loading the spine or something like that.
That is my favorite rehab tool for geriatrics. Like if somebody is like 72 years old and you're trying to get them leg strength, that is like as crazy as it looks from the outside. You're like seeing them push a sled on turf in their freaking double Velcro strap, Dr. Scholl's shoes,
Mm-hmm.
But what it will do to light up their lower body and it's so safe because if they just stop, there's like nothing's going to fall, nothing, they don't have to learn how to rack a bar, just stop and you're done. It's just,
I've gone into doing a lot of that early on for people kind of getting into the weight room because it's such an easy thing to start people with.
Yeah.
So those two have definitely been added in the program a lot more.
Anything you threw out that you were like, oh my God, I can't believe we've been doing this long?
Anything I threw out? Let me think. I haven't thrown stuff out, but I've definitely made things a lot more simple. I think I've tried to whittle down my program to less exercises and less things, and focus on really doing more of the basics rather than trying to think, hey, I need to get this in here, need to get this in here. I've kind of learned that, these things will work themselves in over time, but focus on what's really matters. Just kind of thinking about the essentialism approach as it applies to programming. So I've kind of just whittled down my approach a little bit more.
Nice. Do you guys work with athletes of all ages and active adults. Do you guys have like weight loss clients?
Oh yeah. Yeah, absolutely. We have, there's a little bit of everything. We definitely have some serious weight loss clients right now. Ken Whittier, who actually just left us for a job with the Bruins, but has been with us for a long time, was just with this woman, Marie, who's down about 180 in the last couple of years. So we have a lot of people like that who kind of start with no experience and want to do serious weight loss. Yeah.
Wow. And does the program change at all?
Oh yeah. It's a lot of the same exercises, just how do you prescribe them? Right.
Yeah.
So like, for instance, for that person who's, 400 pounds, like I'm not going to spend time trying to get you to roll on a foam roller when you can't even support your body weight. I'm not going to spend time doing some of these ground-based things.
I'm not going to put a weight vest on you because you already walked in with one.
Yeah, exactly. And then thinking about like, okay, maybe that means we have you throw a med ball and then walk down and back, and then have you do like a TRX supported squat and then do a power-off press and then walk down and back and things like that. And just programming the same things differently, but it's the same tools just kind of spaced out differently through the workout. And then, I mean, really number one thing has to be the food log. Like food logging has to be the step one. And from there you can kind of figure out your program.
Nice. And are you guys using a lot of like wearable technologies at all? Like
MyZone. MyZone's the number one thing for us. Okay. I think we're trying to make sure everybody does that now. We've kind of said it has been optional for clients, but now it's like, hey, if you start, we want you to get one of these because it makes our job easier, and then it gives you direct feedback as to what you're doing.
You're using it as a coaching point as well? Like,
yep.
Okay.
Yeah. For interval work, especially during the conditioning, during the workout, teaching them like, hey, if you're running tempos, I want you to recover back down to the blue or the green, whatever our choice is, and then say, okay, go again. Or our interval work on the bike, having them figure out, we do our assessments of max aerobic speed test, and then having them understand, hey, this is your recovery number, this is your intensity on the bike, so that there's a little bit of buy-in and thinking about what they're doing on their end rather than just kind of burning themselves out every single time.
I love that. I love the idea of the basically. So for those who don't know, MyZone is it's like a heart rate monitor, just displays on a large board for all your gym members. So you can have 8 people working out. They're all wearing a belt, and it has their name and their heart rate. And it's pretty much real time. I mean, there's a little bit of a lag, right? Like a half a second or something. But so it's pretty much real time. But one of the greatest ways to coach I've found is, like you just said, like have them run hard or do something hard, and then say you can't start number 2 until you get into the blue. And it's crazy how much more, a lot of people are talking about like meditation and consciousness and like, being mentally aware. And that one cue, just telling them you can't go until that thing turns blue, is crazy for them to focus on really what's going on right there. Why am I so stressed, or why am I not recovering? And sometimes they'll ask like, oh, why isn't my number going down? Like, why do you think it's not going down? They're like, oh, well, I guess I need to work on breathing. And it's like, okay, but they self-correct, but it's such a useful tool for that.
Yeah. I had a guy like last week, a guy who's kind of like, he's a like very high powered job, stressed, always on the go, not very mindful. And he said something to me about like, why is my resting heart rate so high today? And I was like, I was so happy that he said that, because I mean, that means he took the time to notice that things that I might say to him. He was like, I noticed my resting heart rate was high. So right. if it creates any mindfulness over, what they're doing, then that's a huge win right there. And then I always tell them, it just allows me to do my job better. If I can see what's going on with your heart rather than me having to guess or get your just subjective feedback or go by a standard time interval.
I think I've told this story on a couple other podcasts, but we had a system and we had a guy in there that was very stoic. The whole time his member for a year probably told us 100 words total. Like, thanks. Yeah. Have a good day. Like, but just, you couldn't see any emotion on his face. Anyways, throws on the MyZone and we're just on foam rolling. And one of our coaches looks up and goes, are you all right? And the board's saying he's at 96% of max and we're foam rolling. And he's like, no. And the coach is like, well, are you upset? I got laid off today. And so inside the guy's fuming, but he's stoic. So there's no way to tell that's any different than any other time, It's crazy. And so the coach, to their credit, was like, you're not working out today. Like, you need to go take a long, like, walk, call your wife, like, in fact, have her pick you up. Like, I'm not putting a bar in your hand and having that, your freaking blood pressure shoot through the roof.
Yeah. Jesus. Yeah. I mean, you find out a lot about people just by seeing where they are that day. And right. And that the tool is so like relatively inexpensive for us to use that we're like, we want everyone to make sure they have it. So, yeah,
that's awesome. So Kev, what do you think is the next 5 years of the fitness system? I mean, you've really been an experienced strength coach for, you had a run up as a young kid, but now you're in it, right? Like you've been at Boyles as a full-time, like one of the primary coaches for how many years now?
10. I've been there for 10. So, I mean, I'd say in the last, 5 or so, I've been kind of one of the oldest guys there,
which is funny. But it's funny to me because when we met over 11 years ago, like, to picture you as like the most senior member, because I remember that day you and Brendan both had to work the crap shifts early, the crap shifts late.
Yep.
Freaking clean the toilets at lunchtime and then drive 3 hours to the middle of the night to get to Providence, right? Like,
yeah, exactly. Yes, nailed it.
It was a glorified life, right? But
exactly.
What do you think, what are the trends you're seeing, and where do you think fitness and, this kind of integration of fitness and clinic is going in the next 5 to 10 years?
I think you'll see more people try to develop skills on both sides of the spectrum.
Mm-hmm.
One, because it's become popular. If you kind of keep a pulse on the industry, you see people in the fitness end of things trying to learn some medical skills. You see some people in the medical end, like I've seen in my courses, start to try to get fitness skills. So you're going to, I think, see more people who try to be multi-tool players.
Mm-hmm.
And hopefully, I think from the true medical end, like regular doctors as well, not just PTs and chiros, but like your primary care or other people begin to expose themselves to fitness as well, solely because I think a lot of the answers that they want to be able to provide people and that are going to involve that. Also, I think the consumer, the patient overall is becoming more informed as to how exercise can help them, right? So they'll come in asking questions about it. So I think hopefully you'll start to see people have their hands in a little bit more and at least just educate themselves about the other person's side of the spectrum a little bit more. Because in the end, if we can have everything very integrated, that the patient wins. And I think maybe with the way healthcare has been going, if you start to see a more preventative care approach where doctors can say, hey, this is a fitness approach I believe in. This is where you should go as part of your, plan because of your high blood pressure or your high blood sugar or whatever it might be. And have a doctor say something besides like, hey, 20 minutes of moderate exercise 2 to 3 times a week, which really doesn't mean anything to the average consumer. Be able to say, hey, I know Josh is located here. He can really get you started on a fitness program. If you can start to see that type of network connection, then that's really where the money is. I just hope that we can have everyone kind of want to go in that direction.
Awesome.
Yeah.
Awesome. Well, speaking of people wanting to go in a direction, if they want to take one of your courses, how can they find out more about you and the coursework and get started on along this path so that they can be one of the cool kids who's CFSC certified?
Yeah. So you can go to certifiedfsc.com. It has our full course listing. We're all kind of over the world. What you do, it's cool. You register, you go through the online portion. We have a whole bunch of exercise instruction videos. We have a whole bunch of lectures. Mike's textbook on there as well. Once you get through that material, you do our online portion. And then you go to the event, the practical event that you sign up for on the site. So we're kind of, like I said, all over the world. You go to that practical event, you take a full day course that's really jam-packed with a lot of information. And that's our course. You go through your practical exam at the end, and that's how you join the cool kids. Yeah.
Yeah. You're moving, by the way, in that course. I mean, I love it because in like the SFMA, the greatest part is we have a bunch of clinicians in the room and you see how much dysfunction we're digging out of a relatively healthy group.
Yeah.
What I was impressed with at the CFSC course is no different in strength coaches. You have one guy who's, squat pattern is amazing, but then you ask that dude to go lateral and he's almost falling over his own feet,
Yes. Yeah.
And seeing that, and that's a well-trained, knowledgeable, healthy population. Just wait till you go apply it to your, 40 and above crowd at the gym on Monday. And it's like, oh crap. Like, I'm glad I have a bunch of coaching cues here. I need them,
Yeah. Well, and the big thing when we made that course is we said, like, I want people to come to the course and there's going to be a lot of strength coaches, like you said, who can squat or can deadlift, but like, are you going to be able to teach someone to skip or lateral shuffle or how to jump and land correctly? Because that's all still part of the basics that someone needs to learn, whether it's just a healthy general population person or someone coming out of rehab. They have to be able to learn more variable things than just squat deadlift, right? So
it's like that amazing documentary, Joe Dirt. Have you seen that movie?
It's one of my favorites.
Where he shows up to the fireworks stand and he's like, all you have are snakes and sparklers. Like, yeah, because that's what I like, snakes and sparklers.
Yeah.
And so you guys are helping him find what does he say? Husker do's, Husker don'ts.
Yes, exactly.
With or without a scooter stick.
That's a great reference. I like that.
Yeah, there's so many coaches out there that their programming is based on what they like. And it's like, that's not necessarily serving your client at the highest level. So yeah, you remember that one.
I will.
Yeah. All right. And Kevin, how can people that are interested more in this kind of track about like the massage therapy combined with strength training, your company is called Movement as Medicine, right?
Yep.
Movement as Medicine.
Movement as Medicine. That is also our name on Instagram. That's kind of like our acting blog. We really use Instagram almost daily to put out content. So If you're interested in those types of things, you can find, all of our posts there, or go to our website where we kind of repost everything there as well, which is Movement as Medicine as well. So,
all right. And one last tip for our listeners, if you were to help them become the greatest strength coach they could be, what's one tip you would give them that you've learned along the way? What are the scars that beautiful beard is hiding on your chin where you got hit with the stick of knowledge right in the chin?
Yeah, I think the number one thing is learn about developing relationships first. And that's something I've learned from Mike. And that's probably the best lesson I've learned from Mike is you can get your people to listen to you and follow your program, but only if they know that you care about them and that you take the time to, learn their name, learn about their family, learn what makes them tick first. Then you can apply anything you want. And that's when you look at the strength and conditioning world as a whole, when you see people who are successful, I think that's the number one commonality. Their programming can be different. I see differences in how people, go about how they train people or rehab people. But all the people who are really successful that get buy-in from people and have people talking about them years later are the ones who are very good at developing relationships. So prioritize that first.
Wow. I didn't think you were going to go there. That's awesome. I appreciate it, man.
No,
all right. Well, on behalf of Kevin Carr, this is Dr. Josh Satterlee. This has been a great slice of heaven here, Kevin. I appreciate your time today, man. So on behalf of Kevin, this is Dr. Josh Satterlee saying, go out there, maximize your license, and live the life you dream of.
Thanks for listening to Clinic Gym Radio. If you're ready to double your profit without working longer hours, please visit clinicgymhybrid.com and find out how easy it is to get started on your path to freedom. That's clinicgymhybrid.com.